Hi everyone, today we are going to start with a new topic, that is anti-Parkinson drug. Parkinson is a neurodegenerative disorder that is associated with degeneration of the dopaminergic neuron. And as you can see in the figure, the person with a postural imbalance and rigidity, tremor, akinesia, dementia, these are common symptoms of the Parkinson. So rigidity means stiffness of the muscles, and kinesia means inability to perform the voluntary functions, and stiffness of the muscles, and dementia means loss of memory. So these are all symptoms that is associated with a Parkinson, or shaking of hands, as you can see in the figure. And all these are symptoms of the Parkinson. And Parkinson involves the decrease in the level of the dopamine in the substantia nigra and nigrostriatal region. It occurs due to the imbalance in the level of the dopamine and acetylcholine. Means dopamine level decreases in the brain and increase in the level of the acetylcholine. Acetylcholine, it is excitatory neurotransmitter, and dopamine, it is inhibitory neurotransmitter. Due to the uh, over excitation of the neurons, the symptoms like rigidity, tremor, akinesia, inability to perform the voluntary functions. So all these are symptoms of the Parkinson. And what is the role of dopamine and acetylcholine in all this? Is acetylcholine is a excitatory neurotransmitter, and dopamine is a inhibitory neurotransmitter. In normal person, there is a proper balance in between level of acetylcholine and dopamine, and in patient of the Parkinson, the level of the acetylcholine is normal, but dopamine level decreases. uh, Drug that are used in the treatment of the Parkinson are anti-Parkinson drug, and the main aim behind using this anti-Parkinson drug, or their main role, is to increase the level of the dopamine in our brain. Um this drug act by various mechanism. First is a drug affecting dopaminergic system. In that, first is a dopamine precursor drug. It first drug is a levodopa. It is actually a prodrug. Levodopa converted into the dopamine in our body and increases the level of dopamine in the brain. Levodopa, it is dopamine precursor drug, and dopamine is neurotransmitter, and dopamine cannot cross the blood brain barrier, but levodopa is a drug, and this drug can cross the blood brain barrier. But when it is going to cross the blood brain barrier, the main problem in its process of crossing blood brain barrier is that levodopa, it is metabolized by the two enzyme, that is dopa decarboxylase, and another is the COMT. COMT means catecholamine O methyl transferase. So firstly, this COMT and dopa decarboxylase, they need to be inhibited, so levodopa can cross the blood brain barrier more easily. As you can see in the diagram, this is a levodopa in the peripheral region, and two enzyme that are involved in its metabolism are COMT, catecholamine O methyl transferase, and dopa decarboxylase. Once it is metabolized by this dopa decarboxylase or COMT, it will convert to the dopamine, and as dopamine cannot cross the blood brain barrier, that is problem associated with the dopamine. So dopamine itself cannot use as a drug in the treatment of the Parkinson. So levodopa need to be protected from this dopa decarboxylase and COMT. It is given with a dopamine decarboxylase inhibitor drug. Dopamine decarboxylase inhibitor drug. One is a carbidopa and benzerside. And COMT inhibitor are also preferred in the treatment of the Parkinson. Remember their name, that is tolcapone and entacapone. Tolcapone and entacapone are COMT inhibitor, catecholamine O methyl transferase inhibitor, and dopa decarboxylase inhibitor are carbidopa and benzaraside. So levodopa, it facilitated the process of the levodopa to cross the blood-brain barrier. And levodopa is a main drug in the treatment of the Parkinson. Then we will see about the drug interaction of levodopa. Levodopa, when administered with a pyridoxine is a vitamin B6. It abolishes the effect of levodopa. And levodopa, when given with a antihypertensive drug that are used in the treatment of the hypertension, it causes the severe hypotension. And when non-selective MAO inhibitor are given to the patient, and as well as the levodopa is given to the patient, it causes the increase in the level of the dopamine and noradrenaline, because dopamine, it is degraded by the MAO B, and noradrenaline, they are degraded by the MAO A. So when non-selective MAO inhibitors are given to the patient, it will result in increase in the level of the dopamine, increase in the level of the noradrenaline. And one thing that decrease in the level of the dopamine, it causes the Parkinson, and increase in the level of the dopamine below means above a certain level, means excess increase in the level of the dopamine, it causes the psychosis, means it need to be balanced properly. Then next is the adverse effect of levodopa. Levodopa causes nausea, vomiting, decrease in BP, cardiac arrhythmia, alter taste sensation. Then another is the levodopa shows on-off phenomenon. On-off phenomenon means after 2 to 3 years of the treatment with levodopa, its effect is not remain as that much in the patient of Parkinson. Then dopa decarboxylase inhibitor. Dopa decarboxylase inhibitor are drug that are carbidopa and benzerside. This drug inhibit the degradation of the levodopa, and they are given in the ratio 4:1 to 4:1 with levodopa. And next is a dopaminergic agonist. This drug act as a direct agonist on the dopaminergic receptor. One is a bromocriptine, pergolide, dropinerol, pramipixole. Bromocriptine and pergolide are ergot derivative. Ergot is a indole alkaloid category drug, as it is a claviceps purpurea, and this dopaminergic agonist drug interact with the dopaminergic receptor and increases the level of the dopamine in the brain. Bromocriptine is not preferred that much. Instead of that, ropinerol and pramipixole are more preferred drug. Ropinerol and pramipixole, they act on both receptor D2 and D3. And ropinerol is a FDA approved drug for the treatment of the restless leg syndrome. And next is a MAO B inhibitor. As we discussed before, MAO B, it is involved mainly in the degradation of the dopamine. If MAO B, it is inhibited, then automatically the level of the dopamine in the synaptic cleft will increase, and it will increase the level of the dopamine. So siligiline and rasagiline, these two drugs are involved in this class. And rasagiline, it is more potent as compared to siligiline, and it is longer acting also. And next class of drug is COMT inhibitor, catecholamine O methyl transferase inhibitor. Catecholamine O methyl transferase, it is involved in the degradation of the dopamine. Entacapone and tolcapone, these two drugs, means those drugs that are with a suffix pone. entacapone and tolcapone. These two drugs are act as a COMT inhibitor. In that, tolcapone, it is a more active drug, because it is active in the peripheral region as well as in the brain. Means it can inhibit the COMT in the brain and in the peripheral region also. But one disadvantage that is associated with a tolcapone is a tolcapone, it is hepatotoxic drug. And next is a dopamine facilitator. Dopamine facilitator means drug that is amantadine. Amantadine increase the level of the dopamine in the synaptic cleft. Amantadine is a anti-Parkinson drug, as well as it is used as a antiviral drug also. So antiviral drug with anti-Parkinson activity is a amantadine. And last is a anticholinergic drug. Anticholinergic drug, as you have discussed before, that Parkinson involve decrease in the level of dopamine and increase in the level of the acetylcholine. The level of the acetylcholine need to be decreased, and that's why anticholinergic drugs are given, like benzhexol, piperidine. This drug, they decrease the level of the acetylcholine, act as a antagonist on the cholinergic receptors. So in this part, the classification of the drug is important, and pathophysiology of the Parkinson in brief, as we discussed. And we will see the mechanism of action by this diagram as a revision. That is, levodopa is a main drug in this class as an anti-Parkinson drug. Levodopa, it is converted into the dopamine as it crosses the blood-brain barrier. But before that, in the peripheral region, by the catecholamine O-methyl transferase or dopa decarboxylase, these are two agents that are involved in its degradation. Means they are responsible to convert the levodopa into the dopamine in the periphery. And if the levodopa is converted into the dopamine in the periphery, the dopamine cannot cross the blood-brain barrier. That is the problem associated with the dopamine. That's why it is not used as a drug itself. It cannot be used as a drug because it cannot cross the blood-brain barrier. But because the level of the dopamine need to be increased in the nigrostriatal region in the brain, so levodopa is used in the treatment of the Parkinson. Remember the name of the drug, that is dopa decarboxylase inhibitor, carbidopa and benzaldehyde, and COMT inhibitor, that is entacapone and tolcapone. Once levodopa crossed the blood-brain barrier, it converted into the dopamine, and automatically level of the dopamine increases in our brain. Then MAO-B, it is agent that is involved in the metabolism of the dopamine, and MAO-A, it is involved in the metabolism of the noradrenaline. So MAO-B inhibitor are given to the patient that will increase the level of the dopamine in the brain. MAO-B inhibitor names are siligiline and rasagiline. Rasagiline is more potent as compared to the siligiline. And next is a dopamine facilitator. That drug increases the level of the dopamine in the brain. It is not agonist, but it is dopamine facilitator. That is amantadine. Amantadine is antiviral drug with anti-Parkinson activity. And next is a dopamine agonist, bromocriptine and pramipixole. Bromocriptine is a ergot derivative, and it is from natural source, claviceps purpurea, and other drugs are ropinirole and pramipixole. These all drugs are used in the treatment of the Parkinson. And Parkinson, as you can see in the diagram, it is associated with the symptoms like dementia, then postural imbalance, then rigidity, tremor, stiffness of the muscles. All these are symptoms of the Parkinson. and it is associated with a decrease in the level of the dopamine in the brain, and imbalance in between the level of the acetylcholine and dopamine. And classification of the drug is important, that is dopamine precursor levodopa, peripheral decarboxylase inhibitor carbidopa and benzaraside, dopaminergic agonist bromocriptine, ropinirole, pramipixole, MAO-B inhibitor siligilene, rasagiline, COMT inhibitor entacapone, tolcapone, then dopamine facilitator amantadine, drug affecting cholinergic system, that is benzhexol, procyclidine and piperidine. I have discussed the mechanism of action of all drugs, then their classification, and a brief pathophysiology of this Parkinson. In this topic, firstly, the classification is very important. Mechanism of action is also important. It need to be explained properly. So, thank you.